Okay, good morning, y'all. Hopefully you're catching it on both. I'm dual streaming, so hopefully um, YouTube is picking this up too. Uh, just went live. Still waiting for some folks to join in. Do, 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 do. Okay, let's see here. Good morning, Anna. La 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 la. La 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 la. Is this gonna be one of those mornings I have to restart it? Come on, this. Oh, there's a couple people coming in. Come on, Chris. No, there's a couple people leaving too. Gee, when you start to feel like the last guy on the team that was to be chosen, it's like, fine, we'll take him, but y'all get to go first. Anyway, good morning, y'all. Hope you see we're finally starting to get a few people coming in. This is Primary Care Talk. Let's see if we can get a few people. Nobody said good morning yet, so um, good morning, good morning. Somebody say something. Hey there. All right. Oh, great. Got a subscriber in. Hey, Gail. Good morning to you. Glad to see you this morning. I actually got up way at the butt crack of dawn. Hello, Indiana. Christina. Good to see you. Been up since 4:10. Good morning. I wish you the best back. Right back at you. I love your screen name. Yes, please start clicking the screen. Start the likes up. This is Primary Care Talk. We do everything primary care. You can ask me any question you want. I cannot give you direct medical advice, but I can tell you what I might do in your shoes. Or we can just talk about the day that we're having. I hope everyone's had. It's 7:13 Eastern Standard Time, so I hope some of y'all had coffee already. You probably need it with me. I am ADHD medicated this morning. Okay, really bad? How bad? Tell me what's going on. Oh, what? Do you hear a tapping noise? That's probably my ADD rattling. Just, what about if I talk a little softer? Is that any better? If I talk softer? Come on. I need a little more feedback. No, we're not doing that. There's an echo. I wonder why there's an echo. Let me try putting my other earbud in. Is this any better? Just a second, Big Al. I'll answer that. Let's make sure we get this sound issue. I may have to restart if it doesn't. Okay, great. All right. I like it. Okay, Biggie, I disagree with the idea that you can't take Xanax with pain medicine. Unfortunately, there are forces that don't know anything about medicine. Please keep clicking the screen, y'all. There are forces that don't know anything about medicine that are trying to push things like you can't take benzos and opioids together, and that's just not true. Um, it goes even further than that. There's this thing they do called the triple threat. Good morning, Kathy. There's this thing called the triple threat where they don't want you to give a muscle relaxer, an opioid, and a benzodiazepine all together. And the problem is that you can generally manage a person's pain a whole lot better if you use muscle relaxers as an adjunct. But I've had to stop medically appropriate therapy because there are actual doctors in jail for prescribing this stupid thing the DEA has classified as the triple threat. And it's ridiculous. Don't even get me. I mean, you've already got me started. Don't tell me don't get me started. You've already got me started. Anyway, sorry if there's this one earpiece does a little click thing sometimes. Forgive me. Yeah, Kara, tell them that, you can't, if I was in your shoes, I can't change your mind, but can you wean me a little bit slower? No, 3 weeks, especially for the benzodiazepine, is a incredibly rapid wean. It should be more like 3 months. How does it? Yeah, okay. Ambien is one of those, benzo-like drugs. It usually the funny thing it doesn't activate what we call that stupid triple threat. By the way, I do have, some goals for y'all. Please, consider gifting, consider, becoming a subscriber. Um, Working on getting a regular time, that I'll be online, so but definitely keep the likes coming, y'all. Thank you for following. I appreciate new followers. Good morning from Connecticut. Let's see. Is that Dandrea? Thank you for that. Appreciate love those things. Those are awesome. Thank you, Dana. What other questions do we have? Somebody was asking something about spinal cord, disease, and I don't know if they said something about nerve, things. Should be really concerned about. I have a question, on that. I wish you the best. Um, okay. All right, Christina, just a second. Let me ask, I wish you the best. Are they worried about melanoma, or are they worried about basal or squamous cell carcinoma? Um, Biggie, if I was in your shoes, I'd ask him to leave it where it is, but and I have to say it like this, you don't ever have to raise me. I'd make a deal with the devil right now just to not get cut. Now, the weakness in your left foot, probably means you need an MRI, Christine, and I have a feeling that that's where you're headed anyway. Good morning from Phoenix. Basal. Okay. I wish you the best. Let me say that basal cell carcinoma does not threaten your life. I understand why you're worried because on your eyelid, that's plastic surgery, level stuff. And so I definitely praying for you in that regard. Yeah. Normally, if that nerve is pinched bad enough, if that nerve is pinched bad enough, Christina, normally that's going to be at least a minimally invasive kyphoplasty. Um, I'm just praying. Keep going with the clicks, y'all. Doing wonderful. Um, and Brandy, I'm sorry about that. Okay, Dawn, don't worry about not having them done. Just don't. If they don't work, feel free to stop on the shots. Okay, I believe in cortisone shots to the lower spine. I believe in the targeted treatment remedies. The question is, how much value did you get out of it, and find that you can find that out for yourself. Rather than listening to all the things. Now, when if you ever feel like they're being forced on you, then quit. You won't have a good outcome anyway. Good morning, Mel. Always good to see you. Always good to see you. Let's see. Tylenol, Advil, long term have its own issues. They're not really opioid replacements. I would say this: I manage on Tylenol and ibuprofen as well, and I just try and when I needed opioids, I use them very rarely. I love holistic therapies. I love acupuncture. I love chiropractic. I love herbal teas, for sleep and things like that. I always so whenever it comes to herbals or whenever it comes to complementary and alternative medicine, here's my statement. I believe in and. I believe all things can be helpful, and the key thing is it working? For most things, complementary and alternative, I say give it a month. If you don't see it, then quit, then bag it. Depends on what you're asking about. I like Naprosyn is my main go-to uh, uh, is it Dandrea or is it Dandria? Anyway, yeah, I don't think when it comes to chronic pain, I don't think a pill is not a plan. Okay, so one of those was right. Just understand that in my heart, I'm saying I want to say it right for you. I'm doing fine, Thomas. Thank you for asking. Y'all keep the likes coming. Definitely need a few more subscribers, and any gifts are definitely appreciated. My goal for this live is goggles. So, oh, I love lidocaine patches. I love lidocaine patches. Let's go ahead and mute Kevin for being inappropriate. Uh, okay, so Tom. Okay, Tom. I can probably do Tom fairly easily. I can do Tom fairly easily. What I hate about a lot of cane patches is they're a great adjunct to other therapy. They're a great, fantastic adjunct to other therapy, and yet insurance companies do everything they can to try and not approve them. There's only the problem with lidocaine patches is there's only one medical indication, post-herpetic neuralgia, but they are so useful in so many ways. But that's such a cheap drug, no one's going to go through and do the research to get the FDA indications. And so insurance companies say no just because they're snots and dumbasses, and they can. Um, Cats probably think that it's got menthol in it, even though no, it does not. So we have a lot of trolls in here this morning. There, we are. Hopefully, I've muted a couple of them. I had to get off disability so I could get lidocaine patch. See, that's just stupid. You know, you know that, Mel. You know that's stupid. Exactly, George. Man, always a good morning when I see you come on. The best thing you think the best meds for pain? Listen, the best medicine for pain is the one that works. The number one thing, Jenny, I'm praying for you. The number one thing um, and key point about is don't write for 100 other medicines when an opioid will be the best choice. I definitely need a moderator this morning, but that's okay. Thank you for. I don't know how one even does that. So let's see. Well, first of all, I'm a nurse practitioner who addresses myself as Dr. Mike, and no, it doesn't confuse them. Being a nurse practitioner is an um, integral part of my identity, and I never let my patients forget the fact that I see the world from a nursing paradigm. So no, I don't think it's confusing. I've went through the education. I've put in the time. Uh, I give my patients the commitment. And no, it does not. It is not. They know that I'm a nurse practitioner. Let's see. Okay, it will be your seventh back surgery. When is it time to when it's stop? Okay, that's a very good question. Um, the time to stop doing back surgeries is when there isn't a reasonable expectation that you're going to improve your function. Back surgeries as a method of relieving pain suck. Thank you for that. I wish there are. So hold on a second. Let me see something here. They've refused you surgery. That's weird when they refuse surgery. I appreciate the offer. Right now, I think I'm going to continue to manage. Hey, Carrie, what's up, man? I guess the thing about it is, I really do appreciate the offer, but I feel like I need to know the person that I'm asking to mod because I don't know. I don't know. Maybe it's a weird control issue, whatever. But miss you too, man. Well, you should absolutely, because opioids are only part of a pain plan. Exercise is a part of a pain plan. Getting out and doing, and see most of the other stuff is both a part of the plan and example that it's working. Thank you. I love. I One of my best friends used to be from Shreveport, long time ago. He old, unlike me. And wouldn't your back be? And did you? That one I didn't get. Okay. Changing your diet can do a lot for inflammation. Is that what you're referring to, Angie? Is it Angie? It is Angie. Changing a lot can do a lot. Changing your diet can do a lot for inflammation. The more clean you eat, the better. Especially the more whole food that you eat, the better. Um, I don't know when Vyvanse is going generic. It needs to. Vyvanse is one of the better. I like the Ritalin ADHD meds more than the Adderall salts. That's right. You don't get two shot. The HPV shots are 3 months apart. Agreed. Yeah. Okay, Joe. I think once a year getting a COVID booster is going to be is a good idea. However, I'm waiting because I'm expecting it to be part of the flu shot soon. Shelly, have a great day. Anybody else? I definitely would appreciate any gifts that you're able to give. Keep liking. Oh, I like Curcurum. Again, any supplement, you really need to get it done. Why is it hard to be treated for ADHD? Because a lot of times you needed to have had your diagnosis established before then, and a lot of doctors are unwilling to look at what is blatantly obvious and go, "Well, crap, that's ADD." Um, I do think you need to eke out, is a person depressed? Is a person bipolar? There's some other stuff that you do need to at least examine. But you should still be able to be treated for ADHD at 48. I'm 54 and I'm being treated, although I don't take medicine but twice, 2 or 3 times a month. N- No, I disagree with that statement. I think at 76, I would be leery of doing back surgery. Agreed, Cookie. You're right. That's why we didn't get a I wasn't diagnosed until I was 36. I was not diagnosed until I was 36. Let me tell you the story about how I was diagnosed with ADHD. So I'm going to stop looking at questions for a few minutes because this is actually a fairly interesting story. So I was fat. We all have fat stories. I'm reliving mine currently. so I was fat and I was taking phentermine for weight loss. First time ever that I was taking phentermine, and for the first time ever in my life, I was focused. Oh my goodness, because phentermine is very similar to ADHD medications, and it was like I could count the beats of a hummingbird's wing. It was so amazing. I was like, I'd never realized what it was like to be able to just tune in. Um, and this is how bad it was. I was able to tune in so effectively that if I was talking to my wife and my son was in the background, this was him about the age of 14, and she would ask him a question, and he would tell her a lie, I could tell you that he was lying just based on the sound of his voice in the background on the phone. I'm talking about zoned in. Um, and this is one of the reasons why I don't take ADD medicine now. I don't think anybody should be that tuned in all the time. Yes, keep the likes coming. I appreciate it, y'all. But my point is, I went to my doctor. I went to my doctor and I said, Hey, doc, I think I have ADHD. He started laughing. He almost fell to the floor. And I was like, what are you laughing for? He said, that has got to be the most clinically obvious thing anyone has ever told me in my life. And I said, how come you've never brought it up? And he said, dude, you're 36 years old. You made it through nursing school. You're full-time employed. You're getting, there's nothing that he said, I wasn't going to bring it up if you didn't. And then I went on medicine for a while, and I needed it when I was getting my master's degree, and I needed it when I was getting my doctorate degree. But I cannot stand the medicine crash. That's why I don't take it every day. I can't stand the medicine crash. It just drives me crazy. And my wife puts it like this. She doesn't like the medicated me versus the unmedicated me. So that's why I don't do it. Thank you for that. I appreciate it. I really try to love people, be awesome, and just, really be an example of what it means to love first. That's my main platform. Right? Exactly, Carrie. Thank you. It's blatantly obvious. I call myself. Thank you, Airboat. Now I call myself a delightfully unmedicated ADHD. All right, hold on a second. Let's see here. So you don't understand why I have the glasses on. They're my readers. I'm cheating, and I think that they amuse me, Dega. So absolutely fair question. Gets asked a lot, but I like being amused by my sunglasses. I wear my sunglasses in chat. I need to get off my hydroxychloroquine. But Angie, what are you going to replace it with? I understand your feeling about that. For your rheumatoid arthritis, but what are you going to replace it? Mimi, where I asked, I got my bachelor's at UNC Chapel Hill. Excuse me, my bachelor's at UNC Greensboro, my master's at UNC Chapel Hill, and my doctorate at Gardner Webb University in Boiling Springs. That's fine. For lupus. And again, okay, Angie, you see what I'm saying though. What are you going to replace it with? Okay. Um, it's not like the lupus is going to go away. So I understand the feelings, but definitely talk to your rheumatologist about what else can I do besides hydroxychloroquine. I think hydroxychloroquine is one of the gentler of the rheumatoid, the DMARDs. And I'm not saying that it's not making your life miserable. It's just I think lupus is making your life miserable. I believe in parasitic cleaning. Do I believe in that? I believe in trying it. I'm not quite sure that all the direct benefits it provides, but it doesn't hurt you, so go for it. What else we got? It's been a good one. We're having a good live this morning, y'all. Uh-oh, I missed one here. Hey, Thomas. Okay, this is not going to solve your sleep problems, but do me a favor. If I was in your shoes, I would be taking magnesium glycinate every night. Um, it just improves the quality of sleep without actually putting you to sleep. I'm ha- my sleep health has been so good since I started using it. And again, magnesium glycinate for 30 days. And if it doesn't change it, stop. This is, and again, what am I saying? If I was in your shoes, this is not medical advice. They changed or added. What did they do, Carrie? What medicine did they change you to? Appreciate all the likes, y'all. Keep them up. This thing's getting twisted. It's telling me that let me look. Far be it for me to actually know. It's the pink one, Carrie. That's what if you're gonna be on insulin, you definitely need to be on a basal, Jojo. Okay, you don't need the peaks and the valleys. I'm not saying that meal coverage isn't valid. I try to keep people off insulin to the extent that I'm able anymore. But if you're gonna be on insulin at all, starting with a basal makes the most sense. The reason why I don't low, the reason why I don't like insulin is it's weight positive. It tends to make people gain weight. Skip the hell over what I said. I wanted to see you what you thought. I'm sorry. Listen, Digga, there's a lot of words coming in here. If I miss something, I apologize. So you can ask it again. I told you I'm a delightfully unmedicated ADHD. Mhm. I'm going to try and set some regular live times, and they're going to try and be in the evening. I'm looking at 6 p.m. Eastern Standard Time on Mondays. Definitively is what I'm trying to go for. It's not an official announcement yet, um, but I would like to. I'm trying to find time for that because honestly, live is my favorite part of TikTok. We're going to be wrapping up. If there's any last minute gifts, I sure would appreciate it. Dolphin Chick Lady. Listen, I don't. Dolphin Chick Lady can choose to renew or not renew on her own. I don't need you to prompt that. Dolphin, if you're in here, I'm glad that you were a subscriber. If you're not renewing, that's okay. Thank you for everything you've ever done. That's a stupid thing to remind me of. Well, your money might stop. Good Lord. Okay. Now, Zetia, which is the second drug you said there, Carrie, that is a Lipitor adjunct for cholesterol. Okay, it is not blood pressure. Losartan, I actually hate that medicine, but that's okay. It's not. It works. So I like other sartans. I like valsartan, olmesartan, tamisartan better. Thank you for that, Gator. Thank you for that. I do hope that some of y'all would choose to be subscribers. Hey, Dolphin, you see what I mean? Dolphin, you've been awesome. You're awesome. Don't stress about it. I'm not, that's my point. I think that announcement is stupid to me. I think you're awesome. Don't you worry about it. You've done one, you helped me already just by being you. Oh, that's a Fred Rogers moment. By just your being you. Don't you stress about that, Dolphin. It's so good to see you. Love to see you in my life. She's on a statin. It is no, statins are not for blood pressure. Anyway, okay. I love y'all. I genuinely mean that. I gotta drive a 30-minute trip. And like I said, I'm gonna try and make this more regular. Okay, you sent me a message, Carrie. I'll get to it later then. Thanks for all the hugs. Thanks for all the love. Love y'all greatly. See you soon. Love y'all greatly on YouTube. See you soon.